Okay, so we're going to jump into the webinar and start with an update to the Family First Coronavirus Response Act.
Okay, so just to cover what the Family First Coronavirus Act is all about, it really is made up of two main portions. One is the Emergency Paid Sick Leave, EPSL. It requires employers with fewer than 500 employees to provide paid sick leave, and for employees that cannot work or telework due to COVID-19. As everybody knows, the COVID-19 impact has been might be directly on the employee or the son or daughter under the age of 18 of the employee who cannot attend school or daycare, and employees are automatically entitled to EPSL regardless as to how long they have been employed. And if the employee takes off, time off is taken off for the employee self-care, the employee must be compensated at the higher rate of either the employee's 100% of pay or up to $511 a day, subject to a couple of different things. So the Federal Minimum Wage Act or the Local Minimum Wage Act, and then the aggregate total is matched at $5,110, and this is for a 2-week time frame, so 80 hours. It would be prorated if somebody is working less than a regular 40-hour-a-week work schedule. If time is taken off for care of a sick family member or child who's not in school because of the coronavirus, then the employee will receive 2/3 of their regular rate of pay. This pay then is capped at either 2/3 of their pay, $200 a day, or $2,000 in total.
Of course, all this presumes that the business is open. So we know that many surgery centers are in a situation where they're either going to shut down operations or have already, and in those situations, of course, the paid sick leave is not applicable.
Correct. So then we move into from there, the Emergency Family Medical Leave Act, or the FMLA. This is really an extension of FMLA, and we'll talk about that in just a moment. So this applies only to child care disruption. So there's been a little bit of confusion on that. So sure, the first 2 weeks may be covered under EPSL for the employee if the employee themselves is ill due to coronavirus, but or needs to take time off of work. There's a number of different factors, but this expands FMLA on a temporary basis with employers for fewer than 500 employees. It allows up to 12 weeks of job-protected leave for an employee that has been on the payroll for at least 30 days. This is a little bit different than EPSL, where there is no waiting period. And of course, the leave must be related to the impact from COVID. An employee qualifies for the protected leave when the employee is unable to work or telework or needs to take care of a child if the child is either out of school, ill, or the child care facility is unavailable. So there's two different time frames to make sure you understand, and the first is the first 2 weeks. If it is just EFMLA, the employee taking care of a child, the first 2 weeks are unpaid. If, in fact, the individual is also impacted under one of the 6 categories, then the first 2 weeks there may be some pay there, and we'll talk about that in more detail. And then the remaining 10 weeks. The remaining 10 weeks are weeks 3 to 12, and then those weeks are paid at a different rate. And that's paid at 2/3 of the employee's pay, or again capped at $200 a day, or $10,000 in total. And the employer may not require an employee to use other employer-provided paid leave. So that is one of the things that I really want to point out and highlight during the session, is when employees can supplement and when they can't supplement these leaves. So what's changed since last week? So first of all, the Family First Coronavirus Response Act became effective April 1st. All along up until this point, it was going to be April 2nd, and then last week, the decision was made to back it up one more day and make it at the beginning of the month. Also, under special circumstances and with the employer's permission, now EPSL can be taken intermittently. So what does that mean? We'll get into more of that on the Q&A, but basically, if this EPSL is not due to the employee's own illness, there can be an exception made if the employer agrees to it to allow the employee to take that time intermittently. So if they are taking care of a child, for instance, at that 2/3 pay, and they cannot, and they're working still, and so they can work maybe 3 days a week, and because they have child care arrangements part of the time and not the others, you can make an arrangement for that. Again, the law is looking for employers to be as accommodating as possible. Employers of healthcare providers and doctors and others, healthcare worker deems a provider of healthcare, they may elect not to provide this benefit to those. And Tom, did you want to add to that?
Yeah, so this was kind of a hot topic when the law first passed. Was the language in the law is healthcare provider. And this law is built on top of the traditional Family Medical Leave Act. So the new law referenced the old law for definitions. You look at the old law for definitions, and if you remember the Family Medical Leave Act, the reason it's talking about healthcare providers is it's talking about who can be authorized to say whether somebody can return to work or not. What medical professional can say this, the employee is okay coming back now. So the whole point was healthcare provider was believed when the law first passed to mean licensed practitioners, i.e. those that can bill Medicare, for example. Clarifications that came out this past weekend broadened this definition of healthcare provider a lot for the purpose of emergency paid leave and emergency paid family medical leave. It broadened it so far as to say any employee of a healthcare provider. So that includes not only nurses, but also techs and business office personnel. Now, all that said, the government is funding the payment of this leave, so there's strong incentive to offer it when you can. The government really wants healthcare providers to offer it when it's appropriate. Clearly, they're trying to make a distinction here to incentivize healthcare providers to have staff available and to not disincentivize people from being available to take care of this crisis. Healthcare workers are on the front lines. It's been called a war, So the healthcare workers are the soldiers and fighting this war for us on our behalf. So it's a very tough situation for many people. There's no question about it. But that's where that came from, and that's, I think, why that confusion came about. Long and short of it as well is that if a surgery center is out of business, is not doing cases, then it is not required to pay emergency family medical leave or emergency paid sick leave. So it's in those situations when you're doing cases with a full staff, then there's some discretion. Otherwise, you really don't need to pay because you're not in business or you're not, you're currently shut down. So in some ways it's an issue, but it can be maybe overstated as an issue, I think.
So another clarification is that EFMLA works in conjunction with FMLA. So this is an area that you really need to watch carefully. So if an employee has already used FMLA benefits in this plan year, in the benefit plan year, and usually it's a 12-month look back, the total time still equals 12 weeks. Now, this is a clarification that up until last week, the law was silent on, or the act was silent on. So for an example, if an employee used 5 weeks of FMLA for a different, or of just regular FMLA, what has been available up until, this point in time, April 1st, for an unrelated issue, then only 7 weeks. So they took the 5 weeks, so they really only have 7 weeks left. The other clarification that was made is that EMFLA could also be taken intermittently, provided on circumstances, and if your employer approves. So the employer still has the right to say, you know what, I don't want to do this on an intermittent basis. If you're on leave, you're on leave, and not worry about taking care of a schedule. We recommend that you consult with your human resource professional and take care of that. Moving on into the CARES Act, Tom?
Yeah, so the CARES Act follows on from the FFCRA Act, and it adds many of the things obviously we've been talking about for the last week. The small business loan interruption, or small business interruption loan, I should say, relief for individuals, assistance to severely distressed sectors like airline industry, and then a number of things to support the healthcare industry in general, with supplies, drugs, medical devices, lab tests, and then also provisions that require health plans to cover the cost of the coronavirus test and preventive care measures, and adding resources for rural health, telehealth, support for if volunteers go into hospitals and help in those situations, and then some NDMS staffing matters. So otherwise, it's the rest is funding, but the core of this, which we're going to talk about in the rest of the presentation, is really the small business interruption loan program, the relief for individuals, and some of the other matters that go with all of those things.
So how does the CARE Act impact 401k plan regulations? So this is another area that we're getting a lot of phone calls on. So there are significant provisions of the bill that are coronavirus related, and hardship distributions is one of those. And this new program now allows for qualified individuals to have access to the retirement plan accounts and relieve some of the current restrictions. So for instance, beginning April 1st, the distributions from plan must be coronavirus related, and they take place, of course, after the enactment and through December 31st. And what it really does is it waives the 10% early withdrawal penalty on distributions up to $100,000. These distributions could also be repaid during a 3-year period, beginning right after they receive their distribution and for a 3-year period. So that distribution repayment is not going to be subject to contribution limits. So you receive a distribution that does not count towards your contribution limits of that year, and those contribution limits are imposed every single year. Tax on distribution may be included ratably over a 3-year taxable period. So this is different as well. Typically, if you took a distribution, your tax is due in the same calendar year. Now the taxable impact will take place over a 3-year period. And the one thing to note, though, is that the coronavirus-related distributions are not going to be eligible for rollovers. So if you take that type of a distribution, you're taking the distribution, you can't roll it over into another account. And then administrators of the plan may rely on an employee certification. So that's the proof. The employee says that they need this distribution because of some kind of coronavirus-related situation. So either they themselves are ill or they're caring for a family member. So those same aspects of what constitute coronavirus impact are the same ones that are found under the FFCRA. So the next part of this are the loan provisions. Many employees are concerned right now that they, first of all, can they still get a loan? Secondly, if they miss a loan repayment. So let's talk about that a little bit. So participants may receive a loan during the 180-day period after the enactment of this act, and they can take up to $100,000 or 100% of the participants' vested balance in the plan. And this is important because this is double the current plan limit. So again, this only runs through the end of the year. So this is only through December 31st of 2020. And then again, participants with an outstanding loan that have a repayment due after the enactment, again, through December 31st, can delay loan repayments for up to a year. So they need to work with their plan sponsors to make sure this happens. And then after that, they will offset the rest of the loan repayment schedule to follow the new adjusted date for the loan. Also, and this is important because this is getting ready to take place really quick, and that's the temporary waiver of required minimum distributions. So every year there's a required minimum distribution if you're over a certain age. Beginning this year, those distributions can be waived and kept in the plan. Again, this only impacts the plan through December of 31 of this year, and this includes the 2019 required minimum distributions, which were all due to be paid by tomorrow. So if a distribution has already taken place, then those distributions can be rolled over into a qualified plan, unlike other distributions that take place under this act. So Tom.
So the unemployment tax provisions under the CARES Act, my apologies, 1 second, please. I lost the screen, Rita.
Oh. Okay.
Okay. So under the eligible individuals under the state and federal law will receive an additional $600 per week in addition to their regular unemployment compensation benefit. So each state has different dollar amounts for unemployment compensation. Whatever that amount is, the federal government is adding $600 to that. If a state waives its standard 1 week waiting period, the federal government will fund the cost of that first week of benefits. If an individual remains unemployed after their state benefit runs out, the federal government will fund up to 13 more weeks of additional unemployment benefits at that $600 per week rate.
And I think it's important to note that the distribution amount changes at this point. Once the period of time expires after the typical run for unemployment, which is 26 weeks, the government will fund the 13 more weeks of additional unemployment benefit, but it is at a flat rate of $600. It will not be based on the original calculated rate plus $600. And again, the $600 limit is also right now scheduled to run through July. The Act will continue to provide funding to states that currently choose to implement short-term care. So right now we call it reduced schedule. So someone is on a reduced schedule and they hours are reduced, and in lieu of layoff, they accept a reduction in hours, or the employer has no option but to reduce hours. The employees can go ahead and apply for unemployment benefits for a reduced pay, but if the state itself does not have such a program, then, and they implement one, there's some tax offsets to that as well. So right now, the employee's hours in lieu of pay, if there is a reduction in hours, the state already has it, the state or the government will fund 100% of the cost for the states, and then 50% for states that implement one of these plans through December 31st, 2020.
So small business interruption loans. They're also called the Paycheck Protection Program or the Paycheck Protection Loan. The SBA loan program under Section 7A, I think we'll hear that Section 7A quite a bit coming, in the near future. But that's the section under the Small Business Act that is being addressed here. It's to provide eligible businesses with cash to meet payroll, which includes benefits, and other costs, such as rent, interest on mortgages, and utility payments. Now, these are business mortgages, for example, so loans against property. This is in addition to the typical or traditional Section 7A loan uses, including plant acquisition, construction, conversion, expansion, buying land, all sorts of things that small businesses would do that are really, from a bank's point of view, are assets they can lend against, but also including working capital. But again, the new program, the Business Interruption Loan Program, is in addition to the traditional SBA loan offerings, and those traditional offerings are still available. So who's eligible for a Paycheck Protection Loan? The law expands the previous definitions of a small employer. So the way the loan, or the way the SBA looks at eligible businesses, they have a typical size definition for depending upon what industry you're in. For those who know how tax returns are filed for their business, there's typically a reference to an NAICS number. Maybe some of you heard of the SIC code. It's very similar to that. So based upon your industry code, that's what defines your traditional, whether you're traditionally referred to as a small business or not a small business. But in addition to that, this program makes it available to any employer who's under 500 employees. So it's, again, a little bit of an expansion of the universe compared to what SBA would typically do. It even includes situations for sole proprietors and self-employed, but what we're going to focus on here mostly are what surgery centers see, which is either an LLC or occasionally we see an S Corp, but LLC is really kind of the framework we're using for this presentation. So lenders will also, if you make an application for this loan, the lender, which will be, a bank who's working in cooperation with the Small Business Administration or with the SBA's authority, I should say, they will have the person who represents the entity getting the loan to sign off on some good faith certifications, including that there's uncertainty about current economic conditions. The borrower will use the loan proceeds to train workers or maintain payroll, make rent, etc. The borrower does not have any application pending for a loan duplicative of the purpose and amounts applied for. And from February 15th, 2020 to the end of the year 2020, the borrower has not received a loan duplicative of the purposes of what's being applied for here. So how much can be borrowed under the loans? The loan amount can be calculated as, or the maximum amount, that is. The way to calculate that is it's 250 times or 2.5 times the employer's average monthly payroll cost. So that cost includes salary, wage, bonuses, commissions, other sorts of similar compensation, but it's capped at $100,000 per person. So for any individual who might exceed that amount of compensation, those individuals, for the purpose of calculating the total loan amount, that person is capped in that calculation. It can include payment for PTO or vacation, any other sick leave, but it does not include payment, ironically, out of the previous act, the emergency paid sick leave or the emergency family medical leave. You cannot include those amounts in the calculation. It can include any severance pay made to departed employees, and it includes the employer's share of healthcare benefits, the employer's share of 401k match, let's say. And if your state or local government has an employer tax to the employer based on wages, also includes that amount. Maximum loan is $10 million, but looking at the economics of typical surgery centers, using this 2.5 times average monthly payroll cost, we're looking at somewhere between $200,000 to $500,000 for the typical surgery center. Some of the very largest we're estimating could be maybe $1.5 to $2 million for a very large, very, very large surgery center. But so I don't think any surgery center probably would get up to that $10 million point. So additionally, after the borrowing business demonstrates that the loan's proceeds were actually used to maintain payroll or pay those fixed costs mentioned, like rent, then they're eligible for very generous loan forgiveness provisions. And that loan forgiveness, which would happen, year, 2 years, 3 years down the road, is not taxable. So it's really quite a benefit that's available. So how would the loan forgiveness work? So generally, loans will be forgiven to the extent that the borrower can demonstrate that the proceeds were indeed used for payroll cost, rent, utility costs, or interest on any business mortgage obligations. However, the loan forgiveness will not exceed the amount borrowed. Any reduction in loan forgiveness would be because of the following type of scenario. First off, it's measured for that first 8-week period following loan origination. Did the staff size change? So if the staff size reduced, that would be a reason that the loan forgiveness amount would also be reduced. However, you don't have to look at only staff size. You could instead look at the amount of wages paid. So it's recognized, I think, that some ways that businesses will survive this is to maybe do a reduction in pay for staff generally, let's say. So as long as the reduction in wages paid during this 8-week period after loan origination, as long as the reduction in pay is at least 75% of a year ago, during that period of time, then you don't have any reduced loan forgiveness. It's when you dip below that number, that's when your loan forgiveness amount might be reduced. Again, taxability, the canceled indebtedness, whatever it ends up being, is not taxable. Next, we'll talk about the $1,200 check. Obviously, that was what headliner for a day or two at least, and leading up to the passage of the CARES Act. How that works, it's $1,200 per individual, $2,400 for a joint return. Basically, you have to have at least $1,200 or $2,400 for a joint return in taxation, and that's the amount you're going to be taxed this year. You have to have at least that much in order to get the credit. Okay, if your income this year is going to be less than $2,500 or less than at least $2,500, then the minimum payment to the person should be $600. Okay, so even for those folks that will have less than $2,500 in tax liability, sorry, I think I misstated that, less than $2,500 in tax liability. If you have that situation, your payment from the government will be no less than $600. Okay, so let's say you're earning $75,000 a year, you're eligible for the $1,200 check. Over that amount, the amount over $75,000 a year is reduced 5% for every dollar you're over that amount. The way that works out is once you get to $99,000, then the tax credit is zero. So that's how that phases out. One last thing I'll say, and then I think I turned it over to Rita again, thankfully, is that there are some additional capabilities with the HSA, health savings accounts, and flexible spending accounts. So what they did basically is broaden the types and number of things that you can use HSA funds to pay for. Under the Affordable Care Act, the list of things you could pay for with your HSA or FSA was reduced. Basically, we went back to where it was before with some additional things that can be purchased with these funds on a tax-free basis. In addition, for those folks that have funds in their account and they maybe find themselves furloughed, if they have money in their health savings account, they can use those funds to pay for their health insurance premium to get them through this time. Okay, I guess it's still my turn. Payroll tax provisions under the CARES Act, called the Employee Retention Tax Credit. So as an alternate to the Paycheck Protection Program, PPP, an employer may want to take advantage of this tax credit instead. Basically, it's a tax credit. You can count up to $10,000 per employee per quarter and get a tax credit equal to 50% of that amount per employee in the quarter. So again, it's a pretty substantial funding for businesses that are taking this option. Employers over 500 people may want to take this option because they're not eligible for the program under 500 people. What are qualified wages? For employees with 100 or fewer full-time employees, all employee wages paid are qualified wages, and then you take the $10,000 of those qualified wages. For employers with more than 100 full-time employees, then wages paid to employees not performing services due to COVID-19 related circumstances. So I think as envisioned here, it's maybe a larger business that has maybe multiple areas of business and one division is shut down, let's say, then this is something that they have access to help them keep those folks from that shutdown division with some sort of employment, some sort of compensation during that period. Otherwise, the credit is not available. Again, if you're already going with the Small Business Administration Paycheck Protection Program, but it is available if you're not utilizing that program. one last thing about employer tax is that there's also some cash flow benefit to businesses to defer payment of Social Security tax for a period of time. Again, to cash flow wise get through this period of time where businesses have had a hit to their revenues. So you can delay 50% all the way through 2021 and the other 50% all the way to the end of 2022. So again, quite a bit of relief for the payment of Social Security tax.
And then for PEO clients, it's a little bit different. They would assume the sole liability, and then Social Security tax deferral is not available.
Yeah. So the way that works is if a surgery center has a PEO, and that's a professional employer organization, then the surgery center can direct the PEO to take advantage of this deferral. If they do that, then the client of the PEO is taking responsibility for a future payment of the tax. So that's just something to take note of, is that if you are directing your PEO to do this, you're in fact taking responsibility for later payment.
So now what I'd like to do is jump into some of the new questions we've received throughout the course of the last week, and then also questions that were submitted by those attending today. So we'll start with just the questions. We try to categorize them, but we got a few more questions towards the end, so through them as they appear. So one of the questions is, can I use 80 hours of EPSL for my own COVID-related illness and then again for another reason? And the answer to that is no. The benefit is limited to 80 hours. You may, however, depending on circumstances and your employer's approval, take an intermittent EPSL for reasons related to the care of a child during school closures and daycare closures, and then return to work and then take the remainder of your 80 hours for another qualifying reason. Now, please note that this EPSL is paid at the 2/3 salary. If it is for your own illness, it is not intermittent. If the employee themselves is claiming a benefit under EPSL, the required period of time to leave the office 14 days, so the 80 hours would apply to that. And again, if it is for your own illness, it is paid at 100%. The next question, and we got this one quite a few times, is if my place of employment is open, but I'm on furlough after April 1st, can I receive EPSL or FMLA? And the answer to that is no. If you've already been placed on furlough, that means there is not enough work, so you will not qualify for this, but you will qualify for your state unemployment benefits. So we recommend that employees look into that right away. Next question was, if my employer reduces my scheduled work hours, can I use paid sick leave or EFMLA for the hours that I'm not scheduled? And the answer to that is no. The reason for EPSL and EFMLA must be met. So if you are just reduced schedule, you still have to have this qualifying reason for taking EPSL or EFMLA. Reduced schedules do not meet that requirement, so you may be eligible for unemployment in those situations. You can, however, take advantage of this for both if it's the COVID-19 reason that prevents you from working, and again, the same reasons as before, and the amount of the leave is calculated based on your schedule before it was reduced.
So again, I think the simple thing in my mind to remember with the Emergency Paid Sick Leave, Emergency Family Medical Leave Act, is those are directly tied to COVID-19 issues, illness for the employee or taking care of a child if they are unable to be in school or in daycare because of COVID-19.
So here's another change, and I'm glad this question was asked. May I allow my employees to supplement EPSL or EFMLA with vacation or PTO balances? And yes, as an employer, you can make that decision, but it's up to the employee to decide whether they want to take advantage of that. So you cannot substitute other paid leave for either one of these benefits first. And again, if you decide to allow supplementing these pays, then the employer is not eligible to take credit, any tax credit for the supplemental pay. So again, work with your employees. Employees work with your employers. Unemployment is a big question, so the next question relates to that. Is there a special code or reason I must use when filing unemployment claims? And the answer to that is yes. All claims for unemployment must use the following separation, and that is the disaster-related separation. So for a little while there, it was called COVID-19 separation, but my understanding is that now there is a unified reason on all state unemployment claims.
I think, Rita, correct me if I'm wrong, but that took a little bit of time for the states to get their forms and to get their processes in place. So, you know, they seem to be there.
They are there. Although, and the next question is directly related to that. You know, it's how should I file my claim? Please remember that, like many other public places, a lot of unemployment office centers are closed and accepting claims only electronically or followed by a call center. And really, that's electronic is probably the best and the quickest way to file your claim, followed by actually making a call to a call center to file your claim. And then most centers are, as I said, closed due to COVID-19. But whatever, you want to make sure that you follow your state's unemployment procedure, and it's all available on the state's website. And for instance, some of the groups are now designating specific days based on the initial of your last name. I know Illinois has gone to one that categorizes it by breaks in alphabetical order. There are some states like New York and New Jersey that are using the last 4 digits of your social security number. So again, follow your state rules so that you can get benefits as quickly as possible.
So we have a question that came in that relates to the question, must I use all my PTO prior to filing the claim, and are per diem staff eligible for unemployment? Is a question that came in. So maybe we can talk about that while we're answering here.
Sure. So actually, this is my next question, which is, must I use my PTO, all my PTO prior to filing a claim? So this is an interesting one because most states consider PTO balances as wages due.
So number one is it's state by state.
It's state by state. So everyone was hoping that there would be some coordinated effort on this. That has not happened, at least not at this point. So most states do consider PTO balances as wages due and will offset any benefits based on the fact that you still have wages due, meaning you have PTO balances. Under terminations and a payout of PTO, there's little impact because those wages have already been paid out, so you get your unemployment quicker. But again, under furloughs, most states will delay the start of unemployment benefits until wages are paid. As for per diem employees, if you have a reduced schedule, you are certainly encouraged to file with your state unemployment. The rules are different state by state. Some states have minimum hour or minimum wage requirements before you become eligible. But again, state by state, they are expanding the pool of individuals that can.
You know that the state unemployment offices are very, very busy, but don't give up. If you need to find out, want to find out, keep trying. You'll get in. Applying online is recommended, but persistence, I guess, is really the best way to do it.
So this question came in obviously from an employer. If the employees do not want to work, what can a company do? So this is an interesting one because if the position is considered essential, you may terminate individuals who refuse to work. That's a standard that doesn't go away. We are, though, encouraging employers, if these are positions that are non-essential or that you can make the allowance to put people on leave or provide an unpaid furlough, that would be best. And again, that leave would be unpaid because no paid leave, because it does not fall under any of the qualified COVID. Being afraid of the virus and what it can do does not make a claim. So you really have to think through this. But if an employee does not want to work just purely out of concern, again, you can terminate an employee. You can also put them on furlough if your business can support somebody being out on leave.
And I know there are a couple other questions that came in, for example, about 401k and how to apply for things. So we're going to get to these questions. Just please be patient with us. There are quite a few yet to go here, but I think we're doing pretty good on time.
Okay, great. So this is a question again about somebody who works per diem. This person is calling themselves a regular per diem, but they work 3 to 4 days every week over a long period of time. So let's kind of clarify that per diem and contingent workers are typically occasional workers who are on call and who typically do not work with a regular schedule. So in this situation, I would suggest that you contact your human resource department and see if you qualify for partial benefits. Then ultimately, the state unemployment would make that determination as well. But your human resource department can help you put together hours and the like.
Really, the facts of the role, i.e. the number of regular hours worked, is more determinative than maybe what it's named as for that employee, let's say their offer letter or something like that.
That is correct. And it's not unusual for some of these hours to creep. You start out in a day or two here or there, and then you just continue to work more and more hours. So really work with your human resource department to get your classification corrected or see if there's something that can be done there, and then maybe eligible for protection and benefits under these services. This is another question. If I don't have enough PTO, I'm assuming it needs to cover their benefits. What about my insurance? Again, this will vary by employer. Premiums are typically collected in arrears, which means you'll wind up owing your premium, but your benefits won't be canceled. And so typically when that arrangement happens, it's because there is an intent to return to work. The employer also has the option of billing you for these benefits.
And I think we've stated it either last presentation or earlier today, but many carriers are loosening up the eligibility rules during this time frame, during this month or two. I know Blue Cross of Illinois so far has gone out to the end of April, subject to change, they said, meaning I think it could go longer. So the carriers are trying to get on board with eligibility. However, paying the premium is still required. So I know it's hard to come up with funds to pay the premium at this point for many people, but that's still necessary, even though work hours may be drastically reduced. That part of it is being dealt with.
So, and again, if an employee premiums go into arrears, that means you come back to work. At some point, you'll have to repay those benefit premiums. The next question was somebody who's based in New Jersey, so they wanted some more New Jersey information. Unfortunately, in the session, we're not going to be able to cover all of the state-specific, state-by-state laws, but in general, as I've said before, PTO payment is considered wages and must be declared as unpaid wages. So there is always that question on your unemployment form that asks about that. And then benefits can be delayed while they wait on payment of these due wages that are due. So the next question, if my employer reduces my scheduled work hours, can I use paid sick leave for FMLA? Again, it goes back to that same reason. Reduced schedules do not meet the requirement. So if, in fact, you have a reduced schedule, unemployment may be your best bet. And we talked about supplementing EPSL and FMLA. I think my slide skipped that. So this is another question that came in. I read somewhere that federal government would cover rent payment. Is that true? You heard talk about this before. One of the allowed uses of the Paycheck Protection loans is the payment of facility rent and other expenses.
Yeah, just so to be clear, this is for the company's lease payment for their office building, for example.
And then the next one is, where do contingent employees fall for pay? And this is the same as per diem. I included the question because there's a lot of different nomenclature for these types of positions. Contingent workers are considered occasional on-call workers. If there is no work at a center, then there is no obligation under the regulations to payment. So again, we encourage you to figure out how many hours you work on a regular basis and with your human resource department. How does this help people with compromised health and having to take time off? Again, the FFCRA is very clear on the requirements for eligibility for EPSL. It's for your own illness. FMLA is really the portion that takes care of yourself or a family member or dependent child rather that you're caring for. So just having a compromised health situation, you really need to get a healthcare provider to make the recommendation. So it has to fall within one of those 6 reasons that have been given before.
And certainly if you have the symptoms of COVID-19, get yourself checked out. It may be that your illness is related. So there's a lot of information out about what the condition or what the symptoms are. So get it checked out quickly if that is your situation.
So the next question is, how many hours are needed to work to ensure short-term disability? Again, this is many carriers, it's really carrier dependent, and a lot of the carriers are relaxing rules surrounding eligibility. At MedHQ, we're working with our carriers for extension of coverage through April. Blue Cross Blue Shield has already said they're doing it, Blue Cross Blue Shield of Illinois, and more will come directly in the next couple of weeks from the carriers as to how long they're willing to waive eligibility or the number of hours you must work in order to maintain benefits. Then one of the questions is, what are the options for paying staff if they aren't working? Tom, do you want to take that?
Yeah, I mean, I think what the government has set up is 2 primary methods to help employers get the funds needed to make some payments to employees who you may not have work for. Okay, the Paycheck Protection Loan Program, as explained earlier, specifically is set up to help fund payroll for, let's say, an 8-week period, in addition to a couple other things like rent and utilities. And then also that employee retention tax credit, the other option that we mentioned. Can't do both options. You can do one or the other. And the first one, the Paycheck Protection Loan Program, is only available to businesses that are under 500 employees. So I know we had a couple other questions that came in, and please, if anybody else out there has any question, there should be a box on your webinar tile there to submit another question. But one person just asked, in layman's terms, can you kind of go over that 401k change again? And let me see if I can take a shot at it, and you correct me if I'm wrong, Rita, because I know I know you will. But it used to be that you could get up to a $50,000 loan if you had at least $100,000 in your 401k, right? So 50% up to a maximum of $50,000. Now it's been expanded somewhat. So now the maximum loan from your 401k is $100,000, right? But you still have to have, that amount in your 401k plan in order to take that out. Now, the financial advisor that oversees our plan is in my ear right now. Be very careful about withdrawing your funds. The market came down quite a bit recently, so you're kind of selling low. Maybe you need to, though. So, not saying don't do it if you need to, but it's up to you to decide all that, right? But that's number one, is that the size of the loan possible is basically double if you have the funds in your plan to get that much. The other key provision, though, is many people already have a 401k loan. And for those folks that have a 401k loan and now they're on furlough, they're concerned about how are they going to pay back their loan, because typically that's a payroll deduction and it's automatically taken care of. But when you have a 401k loan, you're basically at default if you're not making your payments. So this CARES Act included provisions that allow deferral of those repayments against your own 401k loan.
I think a quick note to make on that is that while it allows for the deferment, you do have to take positive action. You can't just ignore the fact that you have a loan. You have to take positive action. You have to contact your 401k provider to let them know you want to take advantage of it.
Excellent. So the other one related to this said FMLA, Family Medical Leave. How do I apply? That's a great question, because most of us don't encounter that, And so, simply speaking, it's really contacting the person that represents your organization from HR Matters, right? Maybe it's your supervisor even. That supervisor can help you get in contact with human resources support. But for that one, it's really a personal contact, a phone call to the people that either your supervisor or the HR representatives for your organization. Get in contact and they'll talk through the situation with you.
Right. So and that's true. Not enough has been said right now about regular FMLA. Those leaves are for just regular, ordinary reasons for people to take leave. They're out ill, their spouse is ill. There's, it's a broader range of reasons why you may take FMLA. One of the things that I do want to mention, though, is that under FMLA is still unpaid. So along with this new FFCRA and the new CARES Act, there is no provision to provide paid leave. The only way you get a paid leave under FMLA is if your state provides a paid leave for FMLA, and there are a handful of states that are now doing that.
And last but not least, we'll just say about emergency FMLA, EFMLA, and emergency paid sick leave, EPSL. So we know we're in contact with our surgery centers that we work with, and we're broadly working with the administrator and managers of those organizations on a whole staff basis. So each person, there will be plenty of information circulating about how each person is handled. Each person doesn't have to contact, HR. So we're in contact already, I guess is what I'm saying.
Yeah.
And that's probably the same for everybody else who has an HR representative helping them through this time is it's worth a conversation with your supervisor. Hey, is our HR team helping us on this? My guess is yes, that they're helping on a whole organization basis for your surgery center situation.
Do we want to take any questions? Other questions?
Any other questions? Okay, I see another one here. Our surgery center has 1099s and no payroll. Are we eligible for any program? And the answer, assuming, appropriate 1099, which, that is definitely a way people organize. Yes, independent contractor expenses can be included in the calculation of the loan, in the development of how much loan you have access to under this SBA Section 7 supplemental program. So yes, the quick answer is yes. And I'll just say one more thing about, while we're on the topic of that Paycheck Protection Program. The SBA is still working on getting that program in place. So in fact, it's going to be a few days before anybody is going to be able to apply for that. They're working on it. It's a high priority. There's another program, disaster relief program, that looks similar, but it's not the same thing. The number one difference is that the traditional program does not have loan forgiveness. We want to wait for the new program because that loan forgiveness aspect is a very important feature, obviously. How does your association with MedHQ apply when talking about the 500 employee limit? Is the center specific, or are we lumped together with other MedHQ employee totals? Great question. And I think this would apply to anybody who maybe is joint ventured with the hospital, and maybe the hospital has controlling interest or whatnot. But so if there are employees leased from one company to the other, let's say from some place to the surgery center. So your surgery center has leased employees. Your surgery center counts only the employees that are at your surgery center. Typically, 20, 30, 50 people. That's your head count. Your head count does not include all of the other employees of that leasing organization. Okay, that's been made very clear in the Q&A from the Department of Labor that you only count, you surgery center only count the employees at your location. So with that, I don't see any other questions. I see we're 2 minutes before the hour. So we just want to say thank you very much for attending our webinar. We hope it was helpful. We plan on doing this again next week, assuming there's going to be some questions, and I'm guessing there will be.
And more clarification.
And more clarifications. It's a little bit changing situation, as I know you're all aware. We're doing our best to keep up with it, and hope you join us next time. And 2 o'clock next Tuesday, sorry about that, next Tuesday, April 7th. Have a great day.
Thank you.